Alright, out of the top of the heart we have the aorta, aortic arch, thoracic aorta. You can just call this the aorta. The first branch off the aorta is the brachiocephalic artery, and it's going to branch into 1, 2, 3 arteries. One going to the right arm is the right subclavian artery. One going to the right side of the neck is the right common carotid, and the one going to the other side of the neck is the left common carotid. Attached directly to the aorta is the left subclavian vein, or left subclavian artery. Okay, off of both of the subclavians, you're going to find 4 tiny arteries. They're called the VCTIs. So the V stands for vertebral. This is a small artery that's going to head directly down. So we go straight towards the posterior side of the animal. So there's that vertebral. The next one, C, is for costocervical. This one's going up to the neck, as in cervical neck. So this is the costocervical. Then we have the small artery down here heading towards the heart. It's actually going to the thoracic cavity more, so this is the thyrocervical, T. And then the last one is the easiest to see. It's the internal mammary artery. It's going to go towards your mammaries, the chest. Alright, so let's head out to the arm. Okay, once we leave the chest cavity, it becomes the axillary artery. And the axillary artery is going to turn into the brachial artery after we pass this small artery right here. This is the subscapular artery. So subscapular artery. Then it turns into the brachial artery, this big red one going through here. Ignore the nerves. So brachial artery. Radial artery is going towards the thumb, and the ulnar artery is going to cut through this way and go towards the ulna. Last arteries to pay attention to are going to be, you're going to follow these carotid arteries up, and they branch somewhere around that stylohyoid, if you remember that little stylohyoid muscle. One's going towards the middle, that's the lingual artery, and the other one's headed out underneath the jaw, that's the external carotid artery. So lingual and external carotid. And that's it.